And Republican Senator Lamar Alexander represents that last state, Tennessee. He's also chairman of the Senate Health, Education, Labor, and Pensions Committee and oversees the U.S. response to this pandemic. And Senator, he's joining us by phone, and we thank you for joining us from Maryville, Tennessee. I first want to ask you, Senator, about the president's assessment that the United States is doing an, quote, incredible job containing this pandemic. I'm wondering, do you agree with that?
Well, I can give you my assessment of it. I think in some ways the United States has done a good job. For example, we're moving in one thing that will make the most difference: tests, treatments, and vaccines more rapidly than we ever have. One area where we didn't do as well was the first test from the Centers for Disease Control was a flop. But let's remember that on March the 1st, the New York Times reported on its front page that most experts agree that the United States is about as well prepared as any country in the world to manage like this. And this virus surprised the experts. It moves more rapidly than people expected. It moves silently, and it's been a problem, and it's a problem today.
Do you think that the U.S. response has suffered and has been lackluster when you look at how the government has responded to this virus?
Well, in terms of the number of tests, I think the number of tests is going up 4 to 5 times by the fall, so that schools and colleges that are planning to reopen will be able to have an adequate number of tests for systematic testing. Rated enough money from Congress to allow the states to hire as many contract tracers as they need, which is an essential part of it. And we're moving ahead more rapidly with vaccines, building manufacturing plants. We even know whether the vaccines work in order to cut 6 months off the amount of time it takes. So in those areas, I think we're doing well. But it's a virus that we have having a hard time dealing with, and in some states are doing better than others.
So your state, Tennessee, reported the highest number of new cases since the pandemic. Are you worried states like yours are rushing the reopening before getting control of the virus?
So I'm not ready to say that yet. Our governor has been very reasonable, I think, in his approach. For example, we're among the top 10 states in testing. We've tested all of the prisons, all of the nursing homes. Free tests are available for people in vulnerable areas, minority communities. Anybody who wants a test can get one. So I think our pace is about right from my vantage point, but it's concerning when the number of hospitalizations go up, and I think we just have to watch it very carefully.
Now, studies also show that wearing masks has a significant impact on preventing the spread of the disease. I see you wearing your red and black plaid mask throughout the Capitol. Your staff does as well. The president, however, he refuses to wear one. The vice president continues to say this is an issue states should decide. Should the White House do more and the president do more to urge Americans to wear masks?
Well, I wish the president would wear a mask when it's appropriate, because millions of Americans admire him and they would follow his lead. And his experts have told all of us that wearing social distance and washing your hands is the way we can contain the disease, to go back to school and back to work. It also would help to get rid of this political debate that if you're for President Trump, you don't wear a mask, and if you're against President Trump, you do wear a mask. The stakes are much too high for that. So I understand why he does it. Most of the time he's with people who have been tested. He's been tested, so they're not infecting each other. But there are times when he could wear a mask. The vice president could wear a mask. It would signal to the country that it's important to do so. It would help contain the disease because people admire him and will follow his lead. So I think it would be a sign of strength if he would, from time to time, wear a mask and remind everyone that it's a good way to help deal with this disease. We're going to have to deal with it through 2020 until we get to a vaccine.
I mean, when you see Senator, though, in his rallies, people are not wearing masks. There's not calling out, urging people to wear masks. I mean, how much does that worry you that could lead to this continued spread of this disease without a real aggressive call by the White House, by the president, urging his supporters to do just that.
And lead more by example than by calling out. I don't expect the president to tell us what to do in that sense. He has Dr. Fauci and the other experts who are going to be testifying Tuesday before our committee. They'll be wearing masks. They'll be telling people to wear masks. The health experts are the ones who can do that. I'm just saying, if wearing masks is important, and all the health experts tell us that it is in containing the disease in 2020, it would help if from time to time the president would wear one to help us get rid of this political debate that says if you're for Trump, you don't wear a mask. If you're against Trump, you do.
So the president also continues to give out medical advice. You know, you and I talk about in the halls of the Capitol. I've heard you say repeatedly, listen to the public health experts about what's happening in the pandemic. But the president oftentimes gives false and misleading medical advice. I want you to take a listen to some examples of that.
By April, you know, in theory, when it gets a little warmer, it miraculously goes away.
What do you have to lose? Take it. Hydroxychloroquine. Try it.
I see the disinfectant. Is there a way we can do something like that by injection inside?
You're going to find more cases. So I said to my people, slow the testing down, please.
So what's your suggestion to the American public in these very uncertain times? Should they listen to the president's advice about how to deal with this virus?
Well, I think what the president has said, listen to Dr. Fauci, listen to Dr. Burke, Dr. Redfield. They're testifying Tuesday before our hearing for 2.5 hours. When they did that before, we had every CNN and every network carried them live. So my suggestion to the president all along and to the other political leaders is let the experts do the talking about medicine. People trust them. If Senator Schumer or Senator Alexander or President Trump give medical advice, people will think we're have some. So I stay away from that. And when I repeat what I think is going to happen, I try to give the source for it. So and then Dr. Fauci and others say, look, there's a lot we don't know about this disease, so we have to be very careful what we say about it. The one seem to is that if you wear a mask and you social distance and you wash your hands, those are the three things that each of us can do to make our way through 2020 until we get a vaccine.
So you, of course, have worked for years on healthcare policy, but one thing you have been critical about is this lawsuit now before the Supreme Court to essentially eliminate the Affordable Care Act. On Thursday night, the administration filed a brief in support of that effort. Why are you concerned about that White House-backed effort to dismantle the law before the Supreme Court?
I never thought that was a very good case. I mean, what the government is basically arguing is that when the United States Senate, in fact, repealed the individual care, it repealed Obamacare. I don't remember hearing anybody in the United States Senate saying at the time we thought we were repealing Obamacare. We thought we were repealing the penalty on the individual mandate.
Okay. And I also want to ask you about reports that came out about this weekend, intelligence showing that there were actually Russian intelligence services that were offering bounties to Taliban fighters to pay American and British soldiers in Afghanistan. I wondered, you've seen the reports. I'm wondering if they concern you from what you've read.
I read this story, Manu. One, I don't know if it's true or not. It's just based on sources. So I need to wait to find out if it's true. Number two, if it were to be true or anything like it, it would be considered of the Russian practice over the last several years of doing its best secretly to try to undermine Western governments, including the United States.
Okay. And Senator, I know you don't like to talk about the president's tweets, but he has been active this morning in Twitter, and he shared a very inflammatory video this morning of a supporter in Florida shouting white power at protesters. He praised them as great people. At a time when this country is confronting racism, we're dealing with it in Washington, is this the type of thing that the president should be doing?
Well, Manu, you and I have discussed this many times. I don't try to get on the president's tweets. What I try to do is work with him when I can, as we did with the Great American Outdoors Act last week, the most important bill we passed on conservation in 50 years, and to work with him to try to increase the number of tests and vaccines and to have hearings like we are on Tuesday on what we're doing about COVID. So I'm not going to try to comment on a tweet I haven't even seen.
Okay, no, Senator Alexander, thank you so much for joining us from Tennessee. And that's it for us for Inside Politics. Up next.